Welcome to the Mind Money Spectrum podcast, where your hosts, Aaron Ogti and Trishul Patel, go beyond traditional finance questions to help you explore how to use your money to achieve the freedom you want in life.
In this episode, Trishul and Aaron discuss common client concerns that surface during open enrollment season. Each fall, you get inundated with plan documents from work. But now is a time when your seconds can save you hundreds or even thousands. Often you need to opt in to participate in your employer's health, disability, life, and retirement plan. Likewise, a company match on your 401k or a discount to your ESPP can even mean free money. So don't miss out before it's too late to act. And now, on to our conversation.
Hi, my name is Aaron Ogti. I'm a financial advisor in the Bay Area, and I'm here with Trishul Patel, a wealth manager on the East Coast.
Hey, Aaron, great to be here today, and thanks everybody for listening.
Great to be here as well. So we've been helping clients go through open enrollment over the last few weeks, and I noticed that there's some consistent themes that are coming up in the conversations, and I want to talk to Trish about this. Just kind of sort of like get his ideas. Is the advice I'm giving you open enrollment in line with what he does? But we need to kind of apologize because by the time you listen to this episode, most likely your open enrollment period will be over. And it's really not good advice to get it after the fact. So we're thinking this is what's on our mind, what we've observed in helping our clients and answering some of their questions going through open enrollment. But we're really hoping you remember this episode and listen to it again next year before you go through open enrollment. Or we'll try and share this episode again, but that's probably not going to happen. So again, this is a kind of the things that we observed helping clients with open enrollment that unfortunately probably won't help you until next year, but at least you have a good idea of why we're recommending the things we are. So Trisha, when you looked at open enrollment either for yourself in the past or your spouse or helping clients, what were some of the big things that you looked at first to just kind of make sure clients had in place?
Right. I remember being an employee and having to go through this, and for whatever reason, it always seemed to be at the wrong time. I was always had something else going on, and I was too busy to take a look at all of this bombardment of information. Like these plan documents for either healthcare or life insurance, disability plan. There's just lots of forms and legal work to sift through and contracts and all that. So I just remember it being something that I just didn't want to deal with, frankly. And I can understand why some of my clients probably have felt the same way when they've come across these things.
That's a great point. There are sometimes it's a weird like confluence of these are important decisions. There's so much information that you have to sift through. And it's like, okay, here are the 4 choices available to you for your health insurance. And then here's the 4 choices for the next dozen different potential benefits that you have to decide. And there's definitely that kind of information overload component along with just stress of like, oh, I need to do this. And you also have that deadline, which is always like a weird arbitrary deadline. It's like, okay, it's going to be December 17th. And it's like, it's not the end of the year. It's not the end of the month. There's always you have a 2-week or 4-week period. You have to make these really important decisions that take time away from just life and regular work, that I can see it just increasing that kind of stress and anxiety. And I do think a big part is that information overload, trying to go through all those plan documents. Like I barely know enough about health insurance. Why do I need to be studying up on all of the co-pays, co-insurance, deductibles, max out of pockets, premium differences, and just all of that extra information just sometimes being overwhelming. And I think that's what we're not saying going to go into too much depth and detail explaining all of those terms, but just some of the really big, quick things that we look at. This might be the idea of, if you get that first email from Open Enrollment, or Open Enrollment opens, and like you do a quick glance, and like, okay, I want to make sure everything's in place. If I have time, I'll come back and like really double check. But I just want to make sure that this one important thing is on instead of off. I think that's why I'm thinking about this conversation and how I help my clients. Do you have the disability insurance turned on instead of turned off? And we'll get to like the amounts and what's available to you and is employer pay. Like there's different tax decisions you can make, but just, is it on versus it is off? Because if it's off, that's really bad. If it's on, it doesn't matter which one. That's just kind of marginal decisions. There's a little optimization there, but you need more information. So when you think of that like big picture first glance, if you're trying to get through open enrollment in, I wanted to say 5 minutes, but let's say like 10 to 20 minutes, what are you scrolling through and glancing at and just making sure it's in place?
Right. Yeah. It's those things that you have to opt into that if you don't check a box, you'll just miss out on. And then you got to wait a whole year. Those are the key things you want to keep in mind. And yeah, like, for example, the big one is 401k. Does your employer have a match? If they do, that's free money. You don't want to, just leave off something that simple where you check a box and you could potentially get, I do say free money, but what it means is basically the employer in many situations will match your contribution, meaning you put in 5,000, and if that's below their match amount, you would get another 5,000 from the employer. So yeah, things like that. Go through the list of maybe the 12 things you have to decide upon, and then pick the ones that are the low-hanging fruit and make sure you're opted into those as a bare minimum, I would say.
That's a great idea. I like that we're doing the low-hanging fruit when it comes to open enrollment today. Okay, so you have, again, at least maxing out the company match. For most of my clients, especially in tech, they tend to have incomes high enough that I just want to make sure that they're maxing out the 401k, that most of them can do that. So a quick glance, what is the maximum 401k limit for the next year? I know in 2021, it was 19,500. Now, did it stay at that for 2022? Does that sound familiar?
Nope, it bumped up actually. It's 20,500 now, and then
Okay.
27,000 if you're above 50.
Okay. So again, thank you for updating that. So yeah, are we on track to max out the 401k? And then I might have a quick conversation. If I'm doing my low hanging fruit, I'll default to recommending the Roth 401k versus a pre-tax. The main idea here is this is an additional forced savings. Do you want to try to explain kind of how you do a cost benefit analysis of pre-tax versus Roth 401k? Would you like me to spend way too much time talking about it?
I'll give the high level. If I miss a bullet point, maybe we can fill it in. But the big notion is, with many of these retirement accounts, you have the notion of being able to pay something with pre-tax funds, meaning you don't get taxed initially, or you get a deduction initially, depending on how it's configured. And then when you withdraw the money will grow tax deferred. And when you take the money out, let's say after you retire, then you'll pay income tax on any gains. So that's the pre-tax notion. And then the post-tax notion, commonly known as a Roth configuration, is essentially you pay your income taxes up front, then you put your money into these types of account, they grow, they taxes along the way, tax deferred, and then when you want to take your money out, you don't pay any taxes. So both of these are common options, and when you actually run the math, they actually end up giving you the same net result, assuming your taxes are the same today versus in the future. And there's various differences on why you might want to do one versus the other, but the high level notion is, if you anticipate your taxes are going to be higher in the future, you may want to lean towards the Roth.
That's a great point. And so I think that's the key when I look at this analysis, is that yes, if your tax rates are the same, then a true good apples to apples analysis means it doesn't matter. But because 401ks have contribution limits, if we're looking to max out, the way the analysis would work is I have $20,000. I can put that all in my pre-tax 401k, don't pay taxes, and that grows. Or, if I'm doing my analysis correct, I pay taxes from that money. Let's say it's 25%, so I take $5,000 out to pay taxes, and I put $15,000 in my Roth 401k. And that grows at the same rate of return, but that's going to be tax-free down the road. That's the analysis where if your tax rates are the same, you end up with the same amount of money down the road. Realistically, for pretty much every client, if they're putting money in their 401k, if they're putting $20,000 in their Roth 401k instead of $20,000 in their pre-tax 401k, they're functionally saving more in the Roth because they're paying the taxes with outside money. So in this case, a $20,000 pre-tax 401k would be equivalent to roughly $25,000 in the Roth 401k. Because the idea is that I am saving the same amount, but with the Roth, I'm paying the taxes with extra outside money that allows me to do more than the contribution limit. And so if you were both maxing out a Roth 401k and versus maxing out a pre-tax 401k and they have the same rate of return, down the road, you have more money with the Roth 401k because you already paid the taxes up front. And so I'd say functionally, a Roth 401k is just more forced savings, and that's why it's my default. Sometimes for some clients, we'll do the analysis like, okay, no, actually your tax rate projects to be significantly higher now than in the future. If there's a big stock sale year, that might make sense to do the pre-tax. But the vast majority of the time, if they're looking to max out 401ks, I recommend maxing out the Roth 401k because it's just a subtle, almost like psychological, behavioral perspective. Like they're saving more without realizing it. They're saving more without feeling the difference. And that's the kind of additional savings that really does compound over many years. So that's why, again, when I'm going down my open enrollment, my default, max out the Roth 401k. We'll discuss if the pre-tax makes more sense later, but if nothing else, if that's my quick single advice, max out the Roth 401k, you'll be just fine.
Right. And, one other subtle benefit of the Roth is you have less worry of RMDs. So it's even if it's equal, in terms of how much you may gain, having to worry about RMDs when you're 72 and you don't really need that money quite yet is one benefit that you would get with the Roth. You're not required to take money out starting at age 72 with the Roth like you would with the traditional IRA, or if you end up rolling those 401k assets into the traditional after you leave employment. That's kind of what you might be stuck with.
Yeah, it's also a little easier to access the Roth contributions before age 59 and a half without penalties. There are ways to do that with pre-tax without penalties, but the rules start to get a little more complex. So yes, it is easier to get money out of the Roth before age 59 and a half than it is the pre-tax 401k. So that's one of those like just super tiny benefits that provides a little more flexibility, a little more choice a couple decades down the road.
Mm-hmm. Mm-hmm.
Okay, so after 401k, what's the next thing that you look at when it comes to open enrollment and benefits?
Well, do you think it's worth giving just a notable mention to the mega backdoor Roth?
Oh yes, yeah. So this is something it's been around. Biden tax law proposal was going to remove it. It came out in the last. The plan to prevent Roth conversions of after-tax dollars was removed, so the mega backdoor Roth strategy is back in, or was never technically gone. But yeah, why don't you give a quick description of the mega backdoor Roth 401k?
It essentially allows you to increase your after-tax contribution through a various set of steps. The steps are probably for a different conversation, but essentially we talked about the notion that you can put potentially, if you're less than 50 years old, 20,500 into your 401k. Well, this procedure would allow you to get that closer to 61,000 for 2022. So that means you could potentially defer a lot more if you're in a high salary situation and you're comfortable putting that much away. Well, then, yeah, being able to shelter 61,000 is a lot better than being able to shelter 20,500 a year.
Yeah, it's still Roth, so it's not you're not getting the tax deduction. But like I said, Roth is just more savings, and yeah, if you can put was 58,000 in 2021, 61,000 in 2022. Yeah, if you have the cash flow to be able to put that much in the Roth 401k, then this is one of the single best kind of ways to help yourself in the future. Like just saving more and saving more into a Roth. It just everything tends to work out better as long as you're not leaving it in cash.
Mm-hmm.
Okay. So thank you for that. Thank you for the reminder of the mega backdoor Roth 401k is still around as of now. Okay. So what's next on your checklist?
Okay, so you got the healthcare. At this point, you'll probably not need to think about the disability policy or the group plan offered through your employer.
So that's one of like my important checklists because that's one of the things that tends to apply to everyone, unless they're maybe in their 60s and like a year or two away from retiring. I push all of my clients to participate in the disability insurance. Group disability insurance tends to be more cost effective. This is also something I look for because if they don't have access to a group disability insurance, then I will actually recommend that they go buy a privately owned disability insurance policy and go through the underwriting for that. And so I can recommend a service that can help them. But disability insurance is one of those really important things to have in place because even if you're single, if something happens to you, you still need to pay your bills and be able to pay your mortgage. And if there's a disability situation where you can't work, then that's one of the easiest ways to kind of spend down assets and get in significant financial trouble. So having some disability insurance really is important. Now, again, most of my clients in tech, a lot of tech companies are doing a better job of offering disability insurance, and a lot of times they're paying for it. But sometimes the smaller pre-IPO companies may not be offering that yet. And so having a plan of, okay, if this is not available to you as a group benefit, then we need to go out and get it individually. It's similar to life insurance where, yes, if you have dependents, you need some. So if you have a spouse or children that are dependent on your income, yes, you also need life insurance, whether it's group or a personal policy. But disability insurance, pretty much everyone does need it. So that's one of the things I make sure is in place. Do you have similar thoughts or philosophies, or?
I do, yeah. So I put disability in most situations above life. If you just look at the numbers, the chances of a healthy individual in their 30s, 40s, maybe even 50s becoming disabled is far more likely to happen than passing away, than losing one's life. So, having tons of life insurance, but they're becoming disabled in your 40s, you're not going to be in too great of a shape, right? Your main earning potential could be cut off. Yeah, at the same time, you still have your life to take care of and the life of dependents if you're a breadwinner. So yeah, it certainly makes a lot of sense to focus on disability, I'd say. And then just a little bit of terminology to think about when it comes to disability. There are various types of policies out there. And the way the policies work is if you become disabled, according to the definition of the policy, meaning if you become totally disabled, then the policy will kick in. However, the definition of total disability can be different on a per policy basis. So, one thing you want to look for is this notion of own occupation disability insurance. And what that means is if you cannot conduct your own occupation, then the insurance will kick in. The disability insurance will kick in. And that's important because let's say you have a specialized skill, you're a high level programmer, surgeon, doctor, physician, lawyer, and you are unable to perform the tasks of that specialized skill, then you're going to want to have your income subsidized by disability insurance. Now, the other option that's out there that you may want to avoid or put less weight on is something known as any occupation, meaning the threshold for this to kick in is far higher, meaning you will not be able to claim this insurance if you can perform any occupation out there. Meaning, if you can say, do you want fries with that, and be able to stand up, then likely, even though you can't perform your high paying job, you will not be able to claim this type of disability insurance if you have any occupation policy, meaning you can, in theory, perform any occupation until you cannot perform any occupation, meaning you really can't do anything. That's when that policy will kick in. And, the premiums may look better for the any occupation, but if you're a highly skilled employee, it does make a lot of sense to have an own occupation policy.
Another way I kind of help clients understand how important this is, they might think like, oh, I'm a computer engineer. If I get in a car accident, I'm in a wheelchair, I can still do my job. This might be out of date. I haven't looked at this since I had my insurance license several years ago. But the most common claim for disability insurance was actually depression. And once you change that mentality of like, oh, even if I'm in a car accident and I survive, I can still do my job. Like, well, that specific example might be true. That may not be the cause of your disability. And so it's kind of easier for, again, those engineers or knowledge workers to imagine, oh, even though my body is not able, my mental health is not able to do my job. Okay, that's why disability insurance is important. And like you said, the own occupation becomes pretty important at that point.
Yeah, very good point, Aaron. You, in fact, just again, based on the numbers, mental health issues is up there, if not more common than those physical ailments that we talk about, especially in the younger ages. So, keeping that in mind, there are things to consider that can bring you down, and having some type of policy to benefit you in those situations is certainly sensible to think about.
Yep. So while we'd said disability insurance is more important than life insurance, in big part because you're more likely to suffer from I think it's called a morbidity as opposed to a mortality. You're more likely to suffer some kind of disability than pass away prematurely. Like if you have dependents, spouse or children, or even it could even be a parent, that's when life insurance does become available. And here, sometimes I'll recommend going through group life insurance policies. That tends to be probably a slight majority. The difference being paying a group life insurance policy this year is probably cheaper than a term life insurance policy this year. But as you age, the group life insurance gets a little bit more expensive each year, and it's possible that over a long enough time frame, say 20 or 30 years, a personally owned term policy could be slightly cheaper. Again, I don't really have good data on where that break even is of how long it takes, but I do believe that that is the case. Also, if you have a personally owned term life insurance policy, you never have to go through underwriting again. Whereas if you are using a group policy, if you change companies and the new job doesn't offer group life insurance, if you go over a certain amount, or uh, if they just don't offer that much, then your underwriting, your health situation may change in the future to the point where you can't actually qualify for enough life insurance. So the checklist is: one, yes, you need life insurance if you have dependents. If there's people dependent on your income, you need life insurance. Item number two is kind of how much, and this is a calculation that any advisor or insurance agent can help you with, kind of depending on replacing your income and savings for the next 20 to 30 years. You can get a little more specific if you start to account for the idea that kids will be out of the house at some point, so you don't necessarily need as much life insurance 20 years from now as you do now. So you could design a 30-year term policy with a lower amount, a 20-year term policy with a higher amount, knowing that the 20-year term policy will fall off. So there are ways to reduce the premiums by getting a little more specific from a planning perspective. But if you just have one big 30-year term policy, you're fine. If you have the same amount through group, that's fine for now as well. The next level would be, okay, if we know we need this much for this long, do we want to consider using a personally owned term life insurance policy instead of a group policy, where we're kind of locking in the underwriting and your health as of now. We're locking in that premium for the entire time frame. And if you happen to take on a new job, again, because most of my clients are in tech, is the idea they go from a large established company to a small startup, they don't have to worry about trying to get life insurance at that point in the future. So that's why I say life insurance is like, yes, you need it, but if we have the extra time, going and getting your own policy is a viable alternative to using the group policy that is offered through work.
Right. Yeah. I agree with your point. Spot on, Aaron. And, just to kind of add on, you did mention the term policy. And yeah, there are a few types, term, whole, life, variable, universal variable, and so on. So all of those other ones besides term, they have this notion of like a cash value, and they build up over time, and they're meant to be more permanent in nature, meaning they're meant to last, through the life of the person who's covered. However, with the term, it does have a fixed end date. So what we might find is that the term tends to be a little more cost effective because it has an end date, right? However, I think that is doubly a good thing. As you mentioned, Aaron, you may not need that much coverage as your children age. And also, frankly, you may not need that much coverage as you age just because your wealth grows. Meaning, if you realize you need a couple $1,000,000 to support your dependents, should you pass away, well, if your estate ends up being a couple $1,000,000, in your 40s or 50s, then you may not need another couple $1,000,000 of insurance. So that's something to keep in mind. And again, that's a good benefit of the term. You can stack them, have a lot in your 30s, less in your 40s, and even less in your 50s, and so on. So providing that benefit from a term ladder structure can, again, allow you the flexibility to move around. This portability, you're not tied to an employer, and you can also kind of customize it to your exact situation. Unless you get a pretty good deal with an employer and you plan on sticking around, I tend to agree with what you said, Aaron.
Yeah, so it might be the case. I'm even okay having too much insurance for a year. Let's get the group policy in place now and spend the next year figuring out, okay, what's our long-term insurance plan? Because the group term insurance, especially when you're in your 20s and 30s, tends to be really cheap. It tends to be really cost effective. And I even have some clients, like, they are pretty confident they're going to work at a large company for most of their career, I really am okay if they only use group life insurance. Um, it that is an acceptable alternative. They don't need to go out and get their own personally owned term insurance policy, but most of the time with any decent planning, having their own policy in place does provide additional flexibility down the road.
Mm-hmm. Mm-hmm.
Okay, so what's next on your kind of your low-hanging fruit checklist?
Well, these are the major things that we've already covered. And then at this point, there ends up being just a lot of other ancillary benefits that may not be entirely common in all situations, but they do pop up here and there. However, before we leave the healthcare one, I'd like to say if you do have the option to pick a plan with a high deductible health plan and then qualify for the NHSA, I think that would also be a good thing to do. We have talked about that in other episodes.
Okay, so I okay, I think we're gonna spend a little more time on this. I agree with the math of what you're saying. I kind of tell this to clients as well that the high deductible plan, especially with an HSA contribution, probably will save you money over most years. It's probably the fiscally responsible thing to do. But sometimes I think it's okay to pay the higher premiums if you feel that there'll just be less headaches when it comes to health insurance. Or I think the best example is if you and a spouse are pregnant and you'll be delivering a baby next year, that's probably a great example of go with the really expensive insurance that pays for everything, and all you have is your $250 copay. Because I've seen the explanation of benefits that come with C-sections and deliveries and baby cares. They're 50 to 70 grand. So from that perspective, I will also look at just what is the lowest max out of pocket between and that all the plans will actually say this along with the difference in premiums. And if you know this is going to happen, then it's okay to go with the expensive plans. Also, there's just less coordination on your part, less work to do between the HSA making the distributions, like talking to insurance companies. And so from this perspective, there are times where the higher premiums might be worth the convenience. But from, I think you made a good analogy to car insurance way back in prior conversation, where the difference between collision and comprehensive, if you save that up over 5 years, then you'll have enough to buy the new car anyways. It feels kind of like that, where yes, you could probably save money if you went with the collision only, and then you also have to make sure you have the discipline to save up enough to cover the cost of the new car. But sometimes just having that comprehensive just makes your life a little easier. Like someone else is going to do the work and figure it out and take care of it. And it is okay to it's more like it's okay to trade money for time or peace of mind or convenience. But yes,
Yeah.
the high deductible plan with HSA probably saves you money in most situations. I also got unlucky in one year where we did that, and between me and my children, we have 3 ER visits throughout the year, so it actually ended up costing us a little bit more. That is also the source of my personal frustration. It's like one year, everything was fine. No kids were being born. Didn't have anything other than regular doctor's visits. Okay, let's go with the high deductible plan. Go to the high deductible plan. Oh, we had 3 ER visits, and now it's just a pain dealing with in-network ERs and out-of-network doctors, etc. So that's probably just me projecting my feelings onto math.
Yeah, that there is, a lot of behavioral notions here to think about. If you're someone who just doesn't like dealing with the complexity, we've talked about how annoying that is. Becoming a health expert to deal with cost of benefits and all the different nuances of just keeping up with the payments that end up going back and forth for dealing with insurance providers. It is a real nuisance. The time is also money, so I can see how the low deductible plan could have its own psychological benefits.
That's probably the best way to phrase it. It may not be the most financially responsible decision, but it could be the most psychologically responsible decision.
Right. Yeah. So, if there's nothing major on the horizon, the reason I like the HSAs are not necessarily for the benefits that you get immediately, but the fact that you can put this money in and it's just another tax shelter where you get a deduction up front and potentially you could get a deduction when you take out the money, or basically you can take out the money tax free. So it's like a Roth and a traditional IRA combined into one, the best of both.
Yeah, that's a great
Potentially.
point. That's a
Yeah.
great point. And especially kind of if you have the cash flow, and like you said, if you don't use it this year, you can. So I guess that's one thing to double check, because I have to look this up every time. The HSA versus the FSA, the flex savings account versus the health savings account, and plan specific. Some plans require you to spend the money that year. Other plans allow it to roll over. So that's just
Right.
one
So
thing to double check for your company
yeah,
plan.
the FSA you gotta, and we can talk about that right now, in fact. But yeah, the cousin of the HSA or the older version, I'd say. I think the HSAs are newer, or the FSA, which is the flexible spending accounts. And there's actually two types. There's one for health, and the other for let's see, what do they call it? Dependent care FSAs.
Yeah, there's a dependent daycare FSA that my wife and I did use for 10, 10 years. Yeah.
Right. So yeah, the notion here is you got to pre-fund these. You got to say before the end of the year what you are going to be putting into these accounts for the following year, and you get a deduction on those amounts. So that's the benefit you're aiming for. But yeah, the trouble with the FSAs is they have use it or lose it provisions. So that's the tricky part. You got to be able to estimate these things. For dependent care, it might be possible to estimate these more effectively, but for yeah, who knows? But if you do have some surgeries coming up and stuff like that, maybe it's easier to do.
That's a great point. If you can plan the expenses. So again, my children were in daycare. I knew they were going to be in daycare for the following year. Um, if you have the surgery come up, you also see some people with consistent health expenses. Sometimes I don't remember if you can cover eyeglasses. Sometimes you can cover things like hearing aids. But I do have a couple clients like they had certain health expenses that they incurred every year just based on their personal situation. That would be another example where the FSA could help make more sense. If it's the known health costs for the year. I think sometimes dental work is also included. So kind of check the plan, check what's eligible. But if you know these expenses are coming up, then that can be a good use for the FSA. But the newer HSA that can roll over the future tends to be just a little more powerful.
Right. Yeah. So the compounding effect of rolling that HSA through your retirement, you would probably have a pretty nice secondary nest egg to support your healthcare costs in your 60s and 70s that aren't potentially covered by Medicare and supplemental plans.
Yep. Yep. Okay. So we got DI, life insurance, 401ks, health insurance. Do you have a thought or opinion on like HMOs versus PPOs? So like independent of the high deductible plans, um, I guess do you choose a PPO or an HMO?
Well, I'd say the trade-offs are, flexibility versus paying a little bit more. So I think it comes down to, again, what makes the most fiscal sense, but also what makes the most psychological sense.
That's a good point. Yeah. So here in California, Kaiser's probably the most popular HMO. I have had Kaiser in the past, and I've had no problems. You go into the hospital, everything is done in that one hospital, and it doesn't cost you anything extra. I've since I don't know how long I've been doing PPOs. Being able to go see a specialist for specific issues has been kind of nice, and uh, so there's definitely pros and cons to both. That is more of your personal situation. I also know some people who have used HMOs and they absolutely despise them. That they just have had the worst experiences. I know others who have HMOs that like just absolutely love it. They're like, oh, I get to go to one place and they take care of everything. And
Hmm.
so it tends to be more personal preference um, that tends to have a bigger impact than just kind of cost savings.
Right. Yeah. So just in case it's not clear, the HMOs are typically the lower cost option, and the reason
Yes,
for that
yes.
is you have a primary care physician. You gotta get your referrals to see specialists through that primary care physician. So it's like a two-step process, two gates, to see a
Hmm.
specialist. And with the HMO, with the PPOs, you would pay a higher monthly premium typically, but you don't have those hoops to go through. You can go straight to like a specialist.
There's also with Kaiser as an example, not only do you see your primary care physician first, you see the Kaiser specialist. Now they're likely in the same hospital, so you can sometimes get it kind of same day, or you're like, okay, I'll make you an appointment 2 floors up. But you don't really get to choose the specialist that you see. That can be a restriction with HMOs. Some people love the convenience. Others would like to be able to find the specialist for their individual situation.
Right. Yeah.
Okay. So I did have my note on dependent daycare. That is something that I used the dependent daycare FSA for a long time. Uh, the other anything else on your notes that you want to make sure we discuss? I had a couple small things, but did you have anything else that you were thinking about?
Well, that just the kind of stragglers on the list tend to be things like dental insurance, vision insurance. Sometimes even companies offer legal fees up to a certain limit. So stuff like that. These are known as fringe benefits, and they may actually be offered at minimal cost to you. So if you have the opportunity to take advantage of them, it's one of those things where like you have all of these little benefits on your credit card that you have no idea what they really are, but you're excited about it when you read the initial agreement, and then you totally forget about it when you need it. Well, I think these fall in that category of items, but it's worth revising your mindset on what you are able to get as these types of benefits, just so you're aware. And it could even be small things like a little bit of savings on your parking, or the ability to take advantage of some sort of company amenity on like tickets to shows or stuff like that. So good to understand that these things might be there, and you may have to look to actually know that they exist.
Yeah, I have a few of those that I've seen, especially from the larger companies. They're starting to offer more benefits. So, like you said, they'll cover parking costs. Sometimes they'll pay if you use public transportation or if you for your commute. Although I don't know how many people are commuting these days. Sometimes there might be a gym benefit. Um, like if they don't have a gym on site, they'll if you use this gym across the street, something like that, we'll pay a certain amount for that. There's other kind of wellness benefits that are becoming more popular, including one I've actually seen a couple companies will offer like $2,000 or $3,000 to cover financial planning fees. And so I've had clients look into their employee benefits because I believe they're eligible, where they were already working with me and they liked the services that I provided. So this is just an extra way to save them money on something they're already paying. So looking through those wellness benefits, seeing if there's anything that applies to you. For the legal one, I'm curious if you think that's a if it's worth it. I think that's why the question, like every client asks, is this worth it? Should I do it?
Well, as a step one, if they're covering X amount per year for free, then sure. Right?
Let's say it's something like $200 for the year for legal benefits. They'll do like a will and a trust, but it's also kind of like a legal insurance where if you need a lawyer, you have and you have a significant court case that and legal costs get pretty high, this benefit will cover that.
Yeah, what I might say is if you anticipate something, then it may make more sense. For example, if you plan on getting a will and trust done, $200 is a good deal. So
That's probably a
that
great
may
point.
be the
Yeah,
deciding factor. Yeah.
I think I've had similar thoughts of like if you're already going to do it, then yes, this is a great way to get a will and trust done. But if you don't have anything that you know is coming up, you may not need to just pay the money.
Yeah, right.
Other kind of open enrollment stories that I've been thinking about. I actually did have one client. She was late 50s, early 60s. But she had her dependents had moved out of the house. Her children were grown, and she had been participating in the group life insurance just kind of by default. She just re-upped every year. And I was actually able to point out she no longer needed the group life insurance benefit. And so we actually, when open enrollment came, she turned that off and was able to save her some money on it from her benefits and kind of increase her pace a little bit moving forward. So that's another like why just looking at this in terms of a on off is usually worth the 10 to 30 minutes that it takes. When it comes to like an employee stock purchase plan, participating in the ESPP, if there's an employee discount, it's usually 15%. Almost always makes sense to max that out. The 15% is really just a guaranteed rate of return on that. You can go into depth of like, do you hold on to the shares or do you sell them immediately? But for the open enrollment time, participating in that is again more free money from the company kind of thing.
Good stuff, Aaron.
Anything else that you think of or have seen with open enrollment?
I think we covered the basics and the high level bullet points. Unfortunately, sometimes individual situations do get a little hairy, and you gotta, break out the calculator and the napkins and do a little bit of analysis. But I think for a high level, I think we did do a good job of just covering the low hanging fruit.
Yeah, that's a great point. It just again, spend those first again, see if you can do it in 10 minutes, just making sure the things are on just in case you forget. You can figure out the nuances later or spend more time doing the calculations, but at least when it first comes, don't forget to do the open enrollment. Make sure you just yes, participate in disability insurance. Yes, you have dependents participating in life insurance. You can go back within the open enrollment time and change that. So if you have kids at daycare, sign up for the dependent daycare. Like just look for those things and just make sure they're on. And if you don't need them, make sure that you're turn them off so you're not paying for them. So, but yeah, it does not have to be as daunting as looking through significant plan documents for the 20 different benefits that they're offering.
Right.
Well, thank you for your thoughts and opinions. I really enjoyed the conversation today.
Well, thanks, Aaron. I enjoyed it as well. And if anybody has any tips out there that they've used that we haven't covered when it comes to employee benefits, we'd love to hear. Or if there's a benefit that you think should have been on this list that didn't quite make the cut, we'd like to hear about that as well. So, thanks, Aaron, and thanks everybody for listening.
Thanks. Bye.
Bye.
We appreciate you joining us today for this episode of the Mind Money Spectrum podcast. Be sure to visit mindmoneyspectrum.com to access the entire library of episodes. Remember, it's not black and white, but the wide spectrum of gray area where you get to pursue the freedoms you want in life. Opinions voiced in this material are for general information only and are not intended to provide specific advice or recommendations for any individual. All performance referenced is historical and is no guarantee of future results. All indices are unmanaged and may not be invested in directly. Have a nice day.